Last night I attended a dinner, a national satellite event that was sponsored by Allergan, the manufacturers of Botox, as well as the manufacturers of a new product called Latisse. That's Bimatoprost as the generic name, formerly marketed at a higher concentration as LUMIGAN, used for glaucoma. Latisse specifically is indicated for use for growing and thickening eyelashes, and it is something that is today just recently released. And what I was wanting to do is understand some of the potential adverse events or adverse effects that can occur with the new Latisse as compared to LUMIGAN. I have another video that I've already released giving some of the basic summary that in about 277 subjects there was about a 4% adverse event risk, including in a composite of events such as hyperpigmentation, or that is darkening of the skin along the eyelid margin. Number 2, there was evidence of some hyperemia or redness, redness and irritation to the eye, the eyeball itself. And those are sort of the big side effects that were reported. There was no evidence of iris, that's the color of the eye, darkening with this in this particular study. It doesn't mean it cannot occur, but it is something that did not occur in the study. Now, what the most important thing that I learned last night that I think you as a Latisse user should know about is that if you get hyperpigmentation of the iris, it can be irreversible. And that's something that's a bit frightening, but let's put this into context so there isn't hysteria about this. First of all, in the LUMIGAN studies, the incidence in LUMIGAN is 20 times the strength of Latisse. Latisse is only a 5% version of LUMIGAN, so it's a very, very small concentration of LUMIGAN. LUMIGAN is a prescription specifically designed to manage glaucoma. And in the LUMIGAN studies, they found that the adverse event for having hyperpigmentation of the iris was only 1.5%. So extremely rare to begin with LUMIGAN, which is 20 times more potent than Latisse. And they found that the incidence of hyperpigmentation, which can be irreversible in the iris, to be much more highly likely in individuals with hazel eyes with a speckle pattern. So if you have hazel eyes with a speckle pattern and you're taking Latisse, there is a slightly higher risk of having irreversible hyperpigmentation or darkening of the iris. But in my opinion, I think it's something you need to consult your physician with, and still, given the studies, quite low in its likelihood. Some of the initial sort of shock fears was that you would take a blue eye and convert it into a brown eye. I don't think there's any reported incidence of that, even with LUMIGAN, but certainly possible. And I don't want to give you the wrong advice with this, but just give you sort of general principles. The idea is what happens I said that within that 4% that was reported with Latisse, that there was some evidence of hyperpigmentation or darkening of the skin that was placed. Is that something you should worry about? Is that something irreversible? Well, of course, anything could be irreversible, but what they found is that it does take a few weeks, a few months for that hyperpigmentation or darkening of the eyelid skin to reverse, but it does eventually reverse in most situations. And the difference with that is that the skin has a turnover, which will then, the pigmentation will go away, but with the actual iris, is a type of cellular makeup that doesn't go through the same cellular turnover, so that pigmentation could be permanent. But again, I'm not trying to create hysteria. If you understand those numbers I just presented, it's extremely rare and much more predisposed in individuals with hazel eyes with a speckle pattern. In terms of understanding one more concept in terms of an adverse event is, how does this affect those that have glaucoma or borderline glaucoma? The very important thing, as I always say, is that this video is not meant to dispense medical advice, but basically to tell you the safety label warnings, and for you to consult your ophthalmologist if you have any questions in terms of its effects with glaucoma. Some of the initial studies have shown that the reduction in intraocular pressure, eye pressure, is about 1 milligram of mercury. So it's a very slight degree of decrease in your intraocular pressure. But what does that mean significantly clinically? I don't believe that in Allergan studies they've found that had any clinical merit. But again, if you have a history of glaucoma or low intraocular pressure or some other eye issue, you obviously, before you start Latisse, and even if you get a prescription in the states that require it, like Texas and New York, obviously it probably would behoove you to make sure your ophthalmologist would feel you're considered a safe candidate for that. So hopefully this short video is a good clarification to my last video on Latisse, to give you a little bit more about the prescribing information, give you a little bit more concrete information in terms of the adverse events, and it will help you understand whether you're a good candidate for having this or not, but you must consult your own physician to make sure that in collaboration with your physician you have the right information given to you.